Welcome you into CommonWell TV 2021, right here in our Orlando studios. We're introducing you to some of our CommonWell Health Alliance members. Let's go ahead now and turn our attention to MEDITECH and their executive vice president, as well as a CommonWell board member. She is Hoda SayedFriel. And Hoda, if we can maybe kind of explore how the pandemic has really changed health IT.
You know, the pandemic put a spotlight on a number of things. So the main spotlight it put on is the need for interoperability and data reporting to public health. So that's the main thing. And some of the good things that came out of that spotlight is the EHRs really stepped up to help the healthcare providers. So we came up with reports for reporting PPE, for positivity rates, COVID testing, other supplies, staffing, all of that. And we did it pretty quickly in order to meet the demand. So it actually showed how well the EHRs and the vendor community could work with public health to provide that data that was needed. I'd also put out a spotlight on some critical areas where things weren't going so well. So those were all the good things that we were able to accomplish, but some things that didn't go so well. Lack of communication. Who was in charge? Is it CMS? Was it ONC? Was it CDC? Where was data going? It also provided an opportunity to re-examine our whole infrastructure for public health, and is really spurring a lot of federal funding to shore up the infrastructure, shore up sort of the standards and the things that are needed out there in the field in order for public health reporting to occur, and actually looking at the staffing for public health as well.
Hoda, there was a report that came out during the pandemic asserting that up to 50% of lab reports submitted to public health lacked patient addresses or zip codes. Can you expound on how CommonWell is well positioned to address that?
Certainly. Well, zip codes, you would think zip codes and addresses would be the most simple thing. Like, where do you live? What's your zip code? Well, it's interesting. So it all starts with data collection. So the best thing that can happen in order to sort of fix this is at the point of collection of the information. So a couple of things are in play. Number one, most of the EHR vendors now are using USPS databases, so that when you pick an address, it'll let you know whether it's a real address, what the right format is, what the zip code is. So that's one element that happens at the collection level. There's also another incentive and proposal on the table right now with the Project US @sign. That is something new coming out of ONC to actually create the standard for the format of addresses to be used for these interfaces. So those are the two building blocks. So wherever you're collecting the information, it has to be correct. And then the format has to be in a way that can be recognized by anyone receiving that information. So with CommonWell, the interesting thing is public health does not use the CommonWell network. It's there, it's available. There are tools there to help public health actually reconcile patient addresses, reconcile patient demographic information of multiple sorts. So there is the opportunity for public health to kind of join CommonWell and use those tools that are provided by the members that are part of that alliance. And they're more sophisticated tools than maybe they're using on their own right now. So anyone out there listening from public health, a discussion with CommonWell is certainly warranted.
Well, speaking of CommonWell, I'm going to ask you to get maybe a little nostalgic here for us. We're going to go back down memory lane, and maybe originally why MEDITECH and CommonWell, why that was such a great partnership, maybe the origin behind that.
Yeah, so as we think about the interoperability journey, most of us and our customers started with point-to-point connectivity. That's untenable when you need data from multiple data sources. Then we migrated to connecting to local HIEs, but then you only got the data that was part of that local HIE, and hopping across HIEs wasn't possible. So with CommonWell, the introduction of an alliance that allowed the access to information nationwide across all the different EHR members that were part of the alliance really was a golden opportunity. We saw that we did not, as a vendor, need to build our whole new infrastructure to do sort of those national connection. So we found that it was a solution to a very big problem out there. And we want our customers and healthcare providers to have as much data about their patients when they need it as possible and as soon as possible. So we've actually taken the CCDAs, integrated it by virtue of the connectivity to CommonWell into the workflow of the clinicians so they can use that information to provide patient care. So as we see sort of the movement of the amount of data being shared, CommonWell is going to be that vehicle for MEDITECH. So any new services, any new interoperability interfaces that we're offering, CommonWell is going to be that delivery mechanism. Some of the things that are coming out are, how do we exchange genomic information? How do we have privacy around exchanging that information? How do we use that information that's there for population health? Some of the things coming out with the EHI bulk data play into working with CommonWell and public health to do that data aggregation. So we saw that, in the future, we're going to need sort of that vehicle and to allow our MEDITECH EHR to work in this space. And then we also saw, just as we're all looming and looking at information blocking as well as the government coming in with TEFCA, how were we going to have our customers be compliant with using an interoperability exchange that met the TEFCA requirements? So all of those factors really kind of gave us, we looked at this 7 or 8 years ago, but we knew these things were coming and tried to position our company so that we could sort of meet those challenges moving forward.
And MEDITECH has seen the tremendous growth with the alliance with CommonWell. She is Hoda SayedFriel. She is the Executive Vice President of MEDITECH, along with being a board member here with CommonWell. Hoda, thank you so much.
Thank you, Scott. Nice to be here.
Thanks for watching this episode of CommonWell TV. To get the latest news and updates, follow CommonWell on Twitter. We also encourage you to subscribe to our CommonWell YouTube channel and hit the bell icon to receive notifications when a new episode is posted.